Welcome everyone again to Search Ahead, the series of interviews we are doing to our colleagues in the field to know how things are going on under the current crisis. We have today with us Dr. John Kachimba, Senior Medical Superintendent and Consultant Urologist of Livingstone Central Hospital. And he's also Vice Chair at the National Science and Technology Council, and also Principal Investigator for SURG-Africa in Zambia. How are you today? I'm
well, thanks. I'm well.
Good. Thank you very much to be with us. And I will go straight ahead with the first question. How the current crisis has affected your hospital, Livingstone Central Hospital?
Yeah. Like everything else, I think COVID, all aspects of our lives have been affected. I don't think there's a single part that has not been. And for the hospital, largely because we are now the nominated site for COVID-19 care, management of COVID-19 cases in the southern part of Zambia. So most of what we have done, we have aimed to prepare the hospital for, God forbid, the anticipated volume of COVID-19 patients that may need active management, life support, and other treatments. So that's been the main aim that we've had. Then certainly, the second one is to maintain the delivery of other medical and health services, surgical services, obstetric, pediatric, and all other specialties that we run. We have tried to maintain those services for emergency cases and high priority elective cases. So cancer care patients, we have maintained those. Maternal health and child health services, we have maintained those. But needless to say, there's been a significant reduction in the non-essential, I'll talk about surgery, non-essential surgical services. We have minimized the clinics, clinic visits. We are hoping they'll come to as little as possible. We have literally brought the rehabilitation services out of the hospital, and we have created individualized treatment plans for patients that are home-based. And the follow-up is now done via phone, telephone link. So most of our physios and our occupational therapies practitioners are on the phones calling patients that are undergoing rehab in their homes. The other thing we have done is that we have canceled elective cases to reduce the surgical workload and prepare the team in case they are called upon to assist in the COVID initiative. What we have seen now is that the elective lists that we had dedicated to the various specialties, that no longer works. We decide the cases on a week-by-week basis. So the various specialists will decide what is urgent in particular specialties, and then we allow them to still provide that service. So it's been a bit stressful for patients, definitely for the specialists, because we have so many patients needing various surgeries. But in this current climate, I think we have to rationalize the use of all the resources that we have.
How the national measures to prevent possible contagions has been taken along the country?
All our measures are all guided by the Ministry of Health and the Zambia National Public Health Institute. The Zambia National Public Health Institute is Zambia's take on CDC. It's built on a CDC model, and they are literally leading the response to the COVID pandemic in Zambia. So they have created the guidelines that we are following in terms of repositioning various health centers to respond to the growing threat of COVID-19. So one thing you will see is that we're doing a lot of screening. Anyone entering hospital grounds throughout the country, and definitely in Livingstone, everyone is screened. They'll have a temperature check. They'll have one of our staff run them through a questionnaire. And the questionnaire has evolved. I think when the first cases came through, they were being imported from out of the country, but now we have a lot of local transmission. So the actual questionnaire has been adjusted accordingly. There are a lot of protocols that are now in place that allow us to screen and actively test patients. So presently, all inpatients in the ward, regardless of specialty, they are now being tested for COVID-19, which is it's almost a heightened trigger. Previously, we had to screen, and when you reached a certain score, that suggested a high probability, then you'll be swabbed and tested. But now, all inpatients, especially those with respiratory symptoms, they are all being tested. Same thing with surgical patients. The other thing is we have dedicated a specific operating theater to any patient that may have COVID and require surgery. To date, no patient has required that, to the best of my knowledge. So, but the protocols are in place. There are protocols for the theater procedures. As you go in, there are protocols for anesthesia, intubation, extubation. There are dedicated recovery sites that are as close to COVID wards as possible. And there are various protocols for cleaning and disinfecting the theater after use, the equipment when you have used it. We're doing a lot of training of the staff. In fact, even as I speak right now, the ZNPHI is on the ground training the staff on COVID, on infection control measures that they need to be aware of. The dedicated site in the hospital, the teams are rehearsing a response to managing a patient with COVID-19. The various areas of the hospitals that we'll need. You know very well, the staff will be working in COVID centers. If we do have a patient, they too will be separated from the general community. So all that has been put in place. For Livingstone and other parts of the country, this has brought in other stakeholders who have offered hotels dedicated to housing doctors, nurses, and other support staff who are looking after patients. So it's really a whole countrywide, multi-sectorial, multi-stakeholder initiative to get this under control and hopefully see it slowly reduce.
I see. And of course, this has been affecting the work of SURG-Africa, I presume. How is it affected?
Fortunately for Zambia, two things. One, our field work. We completed our field work towards the end of the fourth quarter of last year. So most of what we're doing is cleaning up the data. We have a few visits that are targeted for later this month, but the majority of the field work which would have been affected in terms of reduced surgeries, in terms of minimal groupings of individuals, those we did last year. So SURG-Africa wasn't too badly affected. But we have some field studies and some other activities that need to be adjusted to be in line with the COVID pronouncements from the ministry. So we are moving most of what we're doing to an online platform, taking advantage of media such as Zoom to liaise with our colleagues in the various study sites. For the field studies into the community, those we have deferred them. We anticipate probably within the next 2 to 3 months, we'll still be able to go out and participate in that. In fact, one of the big studies we're supposed to do it is in conjunction with the Zambia Statistics Agency. So they've deferred their population census as well. So when they are going out, we'll be with them later in the field, later in the year. So for SURG-Africa, we have continued the issue of clinical mentorship. We are still doing it in the district. In fact, this week we have a team that is going around the health centers within Livingstone, strengthening obstetric and gynae care, one-on-one mentorship. We still will have our visit to the neighboring district hospitals. I think the numbers there and the work can still go on with regard to surge activities. And I think going forward, it's even become more important what we were teaching the teams on the ground, because one key thing we teach is controlling the clinical environment, issues of infection prevention, issues of staff attitude towards various protocols. Those need to even be strengthened now more than ever before.
Fantastic. Well, thank you very much for your time, Dr. Kachimba. I hope everything goes well in the hospital, in the country, of course, for you and your family. For the people, thanks to watch the interview. Just remember that you can check on our website and YouTube to carry on seeing our activities and our novelties, and as well to see other interviews. Again, thank you very much, and take care. Keep safe.
Yeah, thanks a lot, Antonio. Have a great time. Bye.